afternoon, everybody. Thank you so much for joining us. I'm Congressman Mike Levin, and this is our latest virtual town hall. I really want to thank our entire team, Missy O'Healy, Jeremy, who makes this possible, the digital virtual town hall possible, our great campaign staff, and of course, all of our volunteers as well. Thank you all so much. We're looking forward to answering your questions, and that's ultimately why we do these. But first, I want to provide just some brief updates. First, I know it's challenging for everyone that we're still struggling with the COVID-19 pandemic. I would much rather be doing this town hall with you today in person, and I hope that we're back to in-person town halls as soon as possible. The Omicron variant has caused infections, as we know, to rise rapidly everywhere, but I am encouraged to see that cases are leveling off here in California. And I'm optimistic that the worst of this wave is behind us. I'm also very glad to see the Biden administration now mailing COVID tests to any household that requests them, and that we're also in the process of making N95 masks free to the public at pharmacies and community health centers. I think we all know that COVID has taken the lives of roughly 860,000 Americans, with over 78,000 deaths in California alone. I know people that have passed of this, and perhaps you have as well. So I also do think it's important that as we consider where we are, that we take a look at where we've been. You think back to where we were about a year ago. Many of our restaurants and small businesses were shut down. Millions had lost their jobs. Our schools were closed. That particularly hit home for my wife and myself. We have two little ones, 9 and 7 years old, in our local public elementary school, and they spent an entire year studying behind a computer screen. Many in our community tragically didn't have enough to eat. I remember meeting constituents in line at the North County Food Bank who used to volunteer there. Never thought in a million years they'd need to use the food bank themselves. But it's been a rough year. I think that's evident to everyone. I hope that we can look at what we've done and think about where we're going. And I'm also very hopeful because over 200 million Americans are now fully vaccinated. Our restaurants and small businesses and schools are largely back open. Thanks to measures we took to fight the virus, thanks to the American Rescue Plan that we passed, our economic recovery is pushing ahead. It was reported recently that new jobless claims hit a 52-year low, not 52-week low, 52-year low last year. The number of initial jobless claims reported last month was the lowest number since September of 1969. And I'm thrilled with that. Also, while we're excited about some of those numbers, let me be perfectly clear. I am as concerned about rising prices as anybody. The food that we buy, the prices we pay for gasoline in particular. And I'm going to do all I can to push the Biden administration to address the supply chain bottlenecks that we're seeing, the labor shortages that we're facing, and to use whatever tools it can, although they are somewhat limited, to help bring down prices, and particularly gas prices. Federal Reserve Chair Jerome Powell said last month that he expects broad price increases to ease substantially over the next 6 months. And frankly, financial markets have largely agreed with that assessment. If they are right, the conditions for a very strong recovery in 2022 are in place. Employment and wages will continue to increase. And I'm particularly excited about the local jobs that we're going to be creating by virtue of the bipartisan infrastructure law. As you may know, this is the biggest investment in many decades for California's roads, bridges, ports, airports, water systems, and more. And specifically, it'll bring to the state of California $29.5 billion for roads and bridges. Again, that's just in California. $9.45 billion for public transportation, $384 million for electric vehicle charging, $100 million for broadband, $84 million to fight wildfires, $40 million to protect against cyber attacks, $3.5 billion in water infrastructure. That's just in California, and $1.5 billion to improve our airports in California. These are resources that I fought for to fund projects that we need throughout our district. And I'm going to fight just as hard to make sure we get that money spent in our district. So what I've been doing, I've been traveling to each of our cities, meeting with our local elected officials, Republicans and Democrats alike. We've been looking at our roads, our bridges, our water systems so that we're ready to bring this much needed funding to our district and to our community. And I'm excited to tell you that some of the funding has already made its way to our district from the bipartisan infrastructure law. Earlier this week, I announced that we have secured $30.5 million in federal funding for the Encinitas Solana Beach Coastal Storm Damage Reduction Project and $1.8 million for the Oceanside Special Shoreline Study. These are projects that are decades in the making, long overdue, and I think are really tremendous progress. Funding for the Encinitas and Solana Beach project will allow us to place more than 1 million cubic yards of sand along our beaches, which will reduce erosion of coastal bluffs, improve public safety, and expand all of the recreational benefits that we know and love that come with larger sandy beaches. And funding for the long-delayed Oceanside Special Shoreline Study will similarly advance efforts to restore our local beaches that have been negatively affected by the construction of federal assets like Camp Pendleton Harbor. So after years of advocacy, along with our local partners to advance these projects, I am incredibly proud that the bipartisan infrastructure law is delivering this crucial funding to our district, and I look forward to seeing that work begin very soon. We're going to put people to work, including jobs that we'll have for many without college degrees, and I'm very excited about that. The bipartisan infrastructure law, I think, is also very important for another reason. It is proof positive that Democrats and Republicans can come together and get things done for the American people. And I think you all know that passing the infrastructure law wasn't easy, but the reality is that democracy rarely is. One of my favorite quotes is from Winston Churchill, which is, "Democracy is the worst form of government, except for all the others." So I've been honored to work in a bipartisan way in the Congress, whether it's to fund our local priorities, get the nuclear waste off the coast at San Onofre, or to help our veterans. And I want to close here and let you know, just this last week, the House passed my Garden Reserve GI Bill Parity Act with a broad bipartisan vote of 287 to 135. That bill addresses the fact that the National Guard and Reserve has been utilized at an unprecedented level over the past 2 years to respond to crises around the country. Think about wildfires or the events of January 6th. They were there at the Capitol. Also think about their part of the response to COVID-19. However, what has been clear is that these service members have not accrued the same GI Bill benefits as the active duty counterparts, often that they serve side by side with. So the legislation reflects the changing nature of the service of the Guard and Reserve and ensures that every day they spend in uniform, they're going to have days that count towards their GI Bill benefits. And I was thrilled that 68 of my Republican colleagues voted with all Democrats in support of that legislation. Next step is in the Senate. We're going to get that across the finish line. The last thing, I actually did have one last thing that I wanted to say, and that's talk about voting rights for all Americans. I had the opportunity to join our friends at the NAACP in North County for their Martin Luther King Jr. prayer breakfast this past week in Oceanside. We obviously passed the John Lewis bill on 2 different occasions. The John Lewis Voting Rights Advancement Act. We passed the For the People Act twice in the House, and then most recently we passed the Freedom to Vote John Lewis bill and sent it to the Senate. And I was very disappointed that the Senate failed just days after we honored Dr. King to change the filibuster rules in order to pass that critical voting rights legislation. I hope that Mitch McConnell and all of the Republicans, the Senate Republicans, as well as Kyrsten Sinema, Joe Manchin, they have to recognize that we've got to be on the right side of history. As Dr. King said, the arc of the moral universe bends toward justice. And that means that we have to advance voting rights and we have to advance civil rights, whatever it takes. So my colleagues and I are going to keep fighting to overcome that challenge and achieve the democratic protections that Dr. King led us towards. With that, I want to pivot back towards COVID-19. We have an incredible guest in Dr. Andrea LaCroix. She's been with us so many different times and is our local expert, along with Richard Garfing, also from UCSD, who we'll be hearing from next month. But if you look back, Dr. LaCroix, at the past many months where we've had you as a guest on these virtual town halls, you've just been so insightful for providing a snapshot of where we are with regard to COVID-19 at this moment in time. Before we got on the Zoom today, I was just commenting, there's this article from the Lancet today basically saying that COVID-19 will be with us, but the era of the pandemic may be coming to an end. I would love to hear your thoughts today, where things stand and where you see the next several weeks headed. Dr. LaCroix, thanks again for joining us. Oh, and I think you're on mute. See, it wouldn't be a Zoom if that didn't happen. If that didn't happen at least once, it wouldn't be a Zoom.
Exactly. That's so I could, pop my Dr. Pepper here without disturbing you. Do you happen to know the number of deaths of Americans from COVID just these last few days before we get started?
I know it's 860,000 overall. I don't know the last few days, but I've seen numbers around 14, 15, 1,600 a day in recent days.
Okay, it's been climbing, in this Omicron era above 1,500. We were below 1,000 before this. So that's sort of the backdrop. But if I could ask Jeremy, I'll tell you where I think this is going, to put up the first graph, which shows wastewater monitoring projections from Dr. Natasha Martin at UCSD. And her modeling, if he's able to put it up here, is what we were shown. Oh, it's not going up? No. You don't have it. It's in the email. Did you get an email from me?
Why don't you just walk us through it quickly, Dr. LaCroix?
Okay, so Natasha Martin's been modeling the COVID pandemic from wastewater in San Diego County very, very accurately. And what this showed was that as early as just after the new year, that we were about to hit the crest, the top of the Omicron wave, around January 11th, and then come down. And in fact, her projections have been very accurate. We are coming down in San Diego County, and even though the number of people testing positive is very high, and we have challenges in our hospitals, and we have increasing deaths, it's incredibly reassuring to me that our wastewater monitoring is pointing the way. The COVID virus is very accurately monitored there. It doesn't matter how many people decide to get tested or whether they're symptomatic or not. And what that tells us is that by mid-February, things should look an awful lot better. The second graphic I wanted to show you that's in Jeremy's email is there's a useful comparison of masks. In past COVID town halls, we've talked a lot about the quality of masks. And, over the last week or two, we've heard a lot about it's time to wear a higher quality mask because of Omicron. And I believe President Biden's going to be making N95 masks available to us, at least through community centers and drugstores, correct?
Correct.
That's what we hear. So I just wanted to give a little shout out about.
There you go. I see a slide.
Here's the infographic. Do you have the wastewater one? Just to make me an honest woman. But anyways, we will look at that. So I just wanted to say a couple things because I have found the communications about masks really confusing. This is an N95 mask. Here's our wastewater. And if you look closely at this, you can see the January 11th peak in new diagnoses and how fast this is going to come down. And I think that's the graph we should have in our minds about the coming weeks. It's already happening.
So on the bottom axis there, what's the, where are we right now? We're right almost to the peak, or we're already past it? No, it's
we're past it. We're past it. Yeah, we're sort of on, in terms of new diagnoses in the actual world, we're well on the downswing.
And that
This is
wastewater
what's,
data is usually
yeah.
how far ahead of the real world data?
It's actually the real world now. The reason why
Okay.
test positive rates ebb and flow is, you know, you've seen people standing in line to get tested all over the place. It almost became a fad to get tested after Christmas and New Year's this year. Everybody wanted to get a test, and the test positive rate isn't as accurate as wastewater monitoring, we don't think. And so one of the questions later today will come back to that. Then the mask guidance has been to wear a higher quality mask. President Biden's going to send us one of these. The characteristic things about N95 masks are that they have these straps that have to go around your head to the back of your head. They fit your face really as almost a seal. In fact, when you take them off, you can sometimes see a circle around your face. And they're highly effective at filtering out viral particles. They also say NIOSH on them. These are the only kind of masks that NIOSH is actually certifying. NIOSH being the National Institute for Occupational Safety and Health, part of our federal government system. This graph you see here, so we're going to have federal government providing a few of these masks to us. It's highly recommended during highly infectious periods, such as the one we've been in, that you wear a higher quality mask. And what this infographic says that appeared in the AARP newsletter just a few days ago is that N95s or KN95s are, or I think they're called something 94s. These are the three kind of masks that filter out the most particles, the most virus particles when you wear them. You've heard a lot probably about counterfeit masks, and I spent a while today researching what they mean by counterfeit masks, because people are worried they're going to be wearing something that's counterfeit. And it turns out that NIOSH will call any mask that's not, they're only looking at these N95. So any mask that's not an N95 that says it's NIOSH certified is called a counterfeit mask. And there were companies marketing masks, especially last year, that said they were NIOSH certified or FDA certified. None of that was true. The FDA temporarily granted emergency use authorization to some masks. They've since withdrawn that. But I just wanted to say KN95 masks are made in China. The KN94s are made in South Korea. It's said that the South Korean government does a little bit better job monitoring the quality of those masks compared to China. But then you have to ask, am I going to be wearing a fraudulent mask of some type? So I just wanted to show you the masks that I like. I wear KN95s. I find these things to be too onerous for me. I, don't want that circle around my face. And I'm also not working in a hospital. So I wear this one. It's got 5 layers. It's said to be, it's said to be probably not a counterfeit because it says KN95 here. And it has a marking that means it was registered the time that it was made with the Chinese government. But this mask, which was marketed through a US company, and one of the earliest ones I was able to get, also a KN95, also has lots of layers and is very comfortable, has the KN95, but no GB number. Is this a fraudulent mask? I have no idea. But what I do know is that it's a good mask. And a good mask is one that has lots of layers, fits your face well, and is highly likely to filter out 95% of the particles coming your way. So I wanted to say that counterfeit sounds awful, but it's not awful. It just means it's not, if the company's saying it's one of these and it's not, that's why they're calling it counterfeit. And the other thing I wanted to let you know is there is a guy who's testing all the masks, which is really where the rubber meets the road. And he's an aerosolist chemist type, and he has a website that you can check for his own evaluation of the quality of all these masks. And Congressman Levin, I can give you that spreadsheet link, and you can put it up on the town hall website if anybody wants to check it.
That'd be great.
I wanted to send that along because I think we've been scared out of wearing some very good masks, and I think it's news you can use.
Fantastic. Well, I'll tell you what, I've been wearing this KN95 mask
exactly.
for, and I have to wear this on an airplane back and forth about 10 hours a week. And I tried one time to wear one of those N95s, and it was not too fun.
Exactly. But the
So-
real message is the cloth masks that we were asked to wear when there were shortages of masks for healthcare personnel do not do as well. And so it's really time to put away our cloth masks and get some higher quality masks, I think. You've seen lots of people, I'm sure, wearing loose surgical masks that just kind of hang off the face and cloth masks that just kind of hang off the face. Those aren't really doing anything. So we have an abundance of masks in this country at reasonable prices now, and you can get a KN95, a KN94, or if you want the N95 mask and be very, very well protected. So that's the bottom line.
Thank you so much for that, Doctor. We have a lot of questions. I want to get to as many of them as we can. And the first one is for you, Dr. LaCroix. This is from David in San Clemente, who asks, are there any new variants that have been identified beyond Omicron? And what do we know about them if so?
Well, David, I wanted to say to everyone who sent questions in this week, you've asked me really hard questions. And so there are new variants that have been identified since Omicron, and there probably will be for a long time. The bottom line, David, is this, that a bunch of infectious disease high-level epidemiologists got together over the past week to talk about where this pandemic was going, and they developed a consensus that they have no idea. So we were told they have no idea. And but Congressman Levin just read to me an article just published in The Lancet, published by Chris Murray at the Institute for Health Metrics and Evaluation, saying that it's highly likely, and we are hopeful as a group, that after Omicron, there will be so many people who've either been vaccinated or infected or both, that there will be a period of low infection levels in our communities coming up really soon, probably starting in March and going through the summer. A new variant could arise. We don't know that there's one on the horizon now that has the characteristics of Omicron or anything similar, but it's a possibility. And as I've said in the past, the H1N1 influenza viruses that we see variants of every year started out in the 1918 flu pandemic. We're going to have that with COVID as well. So this is not the last variant that is going to be of concern to us, but we will learn to roll with them. And we do expect, although we can't predict the future, if anything, we should have learned that by now. We do expect there to be a low level of virus circulating in our communities in a period very similar to early June before Delta came out last year, when we can feel as close to 2019 as we have, perhaps. So that's an optimistic, but I think realistic view of where this is going.
That's excellent news. I'll answer a question now from Tim in Carlsbad, who asks, how much has been allocated from the bipartisan infrastructure law for desalination in our district? Have potential sites been identified? Well, thank you very much for that question, Tim. So this is obviously something that is important to our region, given the need for resiliency and diversity of water supply. I fought very hard, actually had introduced something long prior to the bipartisan infrastructure law called the Desalination Development Act, which would fund $260 million worth of desalination projects in drought-prone areas using best practices with regard to the environment. And we fought very hard to get that funding in the bipartisan infrastructure law, and we were successful at getting $250 million of the 260. So not bad. We're pretty proud of that. In addition, we got $1 billion of money for water recycling. That's roughly a 10-fold greater investment than the federal government has ever made in water recycling. So the short answer is that the funding has not been allocated under either of those programs with any specificity yet, but we are going to work very, very hard to try to get as much of that funding to our region and our district as possible. I've personally gone and visited many of our local water districts and gone and seen their recycling and desalination concepts, ideas. over the last several weeks, and I'll continue to do so because we want to hit the ground running with them. And under the bipartisan infrastructure law, there'll be certain new programs that are set up, and then other existing programs will have a plus up in funding. So we want to hit the ground running. We're already having those discussions as we speak with all of our agencies. Our city leaders are I think, really ready to go, and we're going to be there to help every step of the way. Thank you for the question, Tim. Next, it's a question for both of us from Scott in Oceanside. And the question is, do you think employers should require either proof of vaccination or regular testing for employees to work in an office, as well as requiring masks? So I guess I would just start with the political and policy side of this, and then we can talk about the scientific perspective if you like. I think first and foremost, the science is overwhelming and clear on both vaccinations and masks. The reasons for wanting to get vaccinated and boosted to prevent either infection or hospitalization and death are pretty obvious at this point. Again, I give great credit to the Biden administration for the 200 million plus Americans that have been fully vaccinated. And as far as masks go, I think the chart, the diagram that Dr. LaCroix just put up showing the relative efficacy of different masks is also very self-evident. I'm also very mindful of the recent Supreme Court decision limiting mandates, and we will operate within the Supreme Court's guidance and their decision. What will apply to private employers versus folks in healthcare will be different. I know that there are a number of companies who for example, I frequently travel cross country, and United Airlines is one that is mandated vaccinations. There are others that were planning to do that but have pulled back, like Starbucks with the Supreme Court decision coming out. So I think we're at a place where legally now we'll move forward under this framework, and private businesses will have to make their own decisions with regard to vaccination and with testing. But again, I think the hopeful outcome is that the science and the evidence is overwhelming and encouraging, and ultimately people will see that and make their own decisions and try to mitigate the worst public health outcomes from all of this. But Dr. LaCroix, I'd love to get your 2 cents.
Well, I agree with everything you said, and I would just add that guidance is, something that we would change if the viral levels got very low. Maybe we won't have to wear masks in the office. Maybe we won't have to take tests to create a safe work environment if we get very low levels. If the levels are below, say, test positive rates of 1% or below, that means very little virus is circulating, and then it becomes safer to, eat lunch with other people and things like that. I can also comment that there was a poll conducted among 2,200 Americans in mid-January, and in that poll, 56% of respondents believe that employers should require COVID-19 vaccinations. 33% opposed. Does that sound like any split you've ever heard of before, perhaps? I don't know. But the other thing I would say is that UCSD right now in the downswing of the Omicron, and we are on the downswing, we've been able to greatly reduce the burden of infection on campus by a combination of requiring vaccinations and regular testing. The group that right now our students at the beginning of January had test positive rates of about 25%, and we're down to 5% with the combination of vaccination and testing. And I think that's amazing and wonderful. And also campus employees are around 5% test positive now. And this is regular testing where everybody on campus gets tested regularly. The group that's most adversely affected are the healthcare workers, because they're around people with COVID all the time in the hospital, and they're still having a test positive rate around 15% today. So yeah, I do think it works to vaccinate and have people take tests, but I also think that our continuing need to do that will vary with the rate of virus circulating in the community.
Thank you. I have another one for you from Harry in Carlsbad. He asks, what are your thoughts on the interview with Dr. David Rubin of Policy Lab on just stay the course and ditch testing and resume normal life for students? So hopefully you're familiar with that interview, because I am not.
Well, and I don't know how many listeners today have listened to it, but you can go to NPR and listen to Dr. Rubin's thoughts on children returning to school. And it's a very nuanced argument, but I would say simplified and taken out of context. The argument is we should send kids back to school, don't worry about testing, resume normal life. And that sounds like sort of an abdication of everything we just said, right? About testing and vaccination. He said that the rules for being in school should not be predicated on the decisions of those who've opted not to get vaccinated. But if you read or listen to the interview, I think we have more in agreement with Dr. Rubin than not. And he's just saying that it's important for kids to be in school. He's not saying they should be unmasked. And he's not saying we should never test. But what he is saying is that the disruption of constantly testing kids in school is probably not worth it, particularly when rates of infection become low again. I think his argument is less relevant in the middle of an Omicron pandemic that puts out half the teachers and a good portion of the kids. But I do support with Dr. Rubin, us all being in school together. It's gotten, after 2 whole years, very difficult for kids to not be studying together, very difficult to not have that human interaction, both with other children and their teachers. So I really believe that getting back to normal in school with mitigation that doesn't go over the top is a reasonable position, especially when we get low levels in the community of the viral transmission.
Well, I can certainly relate with, again, 2 kids, 9 and 7 years old, in our local public elementary school for a year behind a computer screen. And it really, I obviously am very grateful to the teachers for their adaptability, to the school administrators, our superintendent here locally and all throughout our district, for their ability to adapt as best they could, but it's no substitute. When our son and daughter were able to go back in person, it was just a wonderful, wonderful day, and they very much missed that interaction. They missed their friends, they missed their activities, and we're just delighted that they're back. And the reality is that our schools here are back in person, and that's the case largely throughout the United States, with limited exceptions. I think the number I saw yesterday was around 96% of K through 12 schools are back, and that's the case, here locally, obviously. And I also, certainly believe that that year, and for some longer, where kids were educated behind a computer screen, certainly did not provide them with the same level of education that they would have otherwise received. Just as I believe that doing meetings like this, as much as I love them, are not as good as doing them in person. We lose a lot when we fail to interact on a personal level with people, and you can only do so much behind a computer screen. Here's a question for me. This is from Linda in San Juan Capistrano. She asked, what communities have been lost and added from redistricting? When do the new district lines take effect, and how does that affect your reelection? Linda, it's a great question. We know our new district lines. So every 10 years with the census, we redraw the district lines. California, for the first time ever in reapportionment, went from 53 districts to 52. And the good news is that the heart of our district remains intact. In fact, the new district is roughly 89% the same as the old district, or as the current district. The differences are that we add a great city in Laguna Niguel. It's a city of about 65,000 people in South Orange County. We maintain the cities of Dana Point, San Juan Capistrano, San Clemente, along with Rancho Mission Viejo and Ladera Ranch. Then, of course, we continue to have Marine Corps Base Camp Pendleton. And then North County remains intact as well. So the core 6 cities, Carlsbad, Oceanside, Vista, Encinitas, Solana Beach, and Del Mar. Where we lost the population was the parts of the district that are in the city of San Diego. So specifically Rancho Santa Fe, Fairbanks Ranch, and the campus of UCSD. Now that hurts because we love our campus at UCSD, but I would just remind everybody that, in terms of the voting population on campus, it's relatively small. Most of the students live in the adjacent areas, including some of the areas that we will continue to represent. So go Tritons with that. We are very pleased with this outcome. We feel that large changes to our coastal communities of interest were unwarranted. And we're going to do all we can, work as hard as we can for every last vote, leave no stone unturned as we always do. And we're going to wage a spirited campaign against whoever it winds up being in the fall. And we feel confident that with your help, we will prevail in the fall. So I'll turn it back to another question for you, Dr. LaCroix. This is from Linda in Encinitas. Wastewater has been monitored for COVID levels in many cities, and Boston now shows a reduction in levels of COVID. Do you know if that trend is nationwide for COVID levels decreasing? And then she asks something that you've already answered at the intro. Does San Diego track wastewater levels for COVID? And I believe that we were among the very first, UCSD was among the very first places to track wastewater, and that's really been a national model.
Absolutely. And it can be done in schools. It can be done locally. You can kind of pinpoint where there's COVID and go from there. They've done it on our campus, for example, and through wastewater, they can tell us what buildings they have viral circulation in. And if you were in that building, then maybe you want to get tested or monitor yourself for symptoms. So I can't say that wastewater is being monitored throughout the country everywhere, but I can say that it is being monitored throughout the country, and that this is a new public health tool to understand COVID-19 spread in the community. Towards that goal, the CDC and the U.S. Department of Health and Human Services has initiated the National Wastewater Surveillance System in response to the COVID-19 pandemic. And the data generated by that system will help public health officials to better understand the extent of COVID-2 circulating in our communities, which is what we've been talking about with every question today. So CDC is currently developing a portal for states, tribal lands, local and territorial health departments to submit their wastewater testing data, and that will be used in the future. It's not meant to replace existing COVID-19 surveillance systems, such as testing positive rates or hospitalization rates, but it is an efficient pooled community sample. And if you're curious what all that means, what it means is that they basically monitor in the sewage. They put magnetic markers that stick to the COVID virus and give us an indication of how much virus is in the wastewater. If you see a peak in wastewater of the virus, you know that the clinical or the hospitalization peak is going to come soon, within the next week or two. But if it starts going down, that's also a good sign. And so that's why those graphs I showed you with that steep downturn modeled by Dr. Martin is so exciting. And when we saw that at the beginning of January, it really gave us hope that even though we were going to be in the thick of it during the month of January, things were going to be going in the right direction very soon. I think that helps. So yes, we're doing it in San Diego. There are lots of programs, preschool programs, school programs, universities, and then the whole county. I think the data that you're seeing right there comes from, I guess there's a majority of the wastewater in San Diego County monitored from a Point Loma facility. So more than you wanted to know, but I hope this is a good answer to the question.
Well, thank you so much for that. Ed in Encinitas asks, what major projects or improvements have been identified for North County in the bipartisan infrastructure bill? Ed, that's a great question. What I have been doing is going city by city, agency by agency, trying to plant the seeds with them for the projects that might qualify, things that have been on the back burner in many cases for years, and in some cases even decades. Everything from improvements to our low sand rail corridor, one of the most important rail corridors in the United States from both a passenger and cargo and strategic perspective. Every city has projects that they're working very hard to bring to the different programs eligible in the bipartisan infrastructure law. I've been literally going out there walking neighborhoods and seeing different intersections and different parts of our freeways and our bridges that need fixing. I was just in Oceanside a couple of days ago with the mayor there, seeing the improvements that are needed around the harbor. Every city has its own needs, and every city will be working very aggressively with their electeds and their staff to try to find as many of the projects as we can and fund them through the bipartisan infrastructure law. We've already had some great successes. So just last week, the first tranche of funds through the bipartisan infrastructure law came from the Army Corps of Engineers. And what we saw was that two projects that have been long overdue are moving forward. One in Encinitas and Solana Beach to provide that roughly 1 million cubic yards of sand on the beach. It's a multi-year, very significant project that we had originally gotten the funding about 2 years ago or a year ago for the planning, engineering, and design phase of the project to be completed. And now that it has been, this new $30.5 million is for the actual construction. So we're very excited to get that sand back on the beach, both from a safety perspective as well as from a recreation perspective. The other that I can point to from last week was $1.8 million to complete the Oceanside Special Shoreline Study. This has been something that has been literally decades overdue. With the construction, the federal construction of Oceanside, Camp Pendleton Harbor, and the impact that's had on the beach in Oceanside, the federal government has a responsibility, which was actually defined in statute over 20 years ago, to study the impact of that construction and then figure out a way to mitigate the loss of that sand in the city of Oceanside. And years have gone by, and that obligation from the federal government has been unmet. When I took office in 2019, we aggressively pursued that project, and we're proud to announce now the money to complete that study. After which, just like in Encinitas and Solana Beach, once the study is completed, then we'll shift to the construction phase of that project. So we're really, really delighted with the progress. We're grateful with the results, and very grateful also to have built strong relationships with the Army Corps of Engineers over the past 3 years that I think will serve our community well for decades to come. So that's just a couple of examples. We've had I personally have had great conversations with Secretary Granholm, Secretary Buttigieg, and others about the relative projects and how we can bring those resources to North County. So stay tuned. We're very excited about all this and look forward to the jobs that will be created as well. I'll turn now another question for Dr. LaCroix from Lisa in Carlsbad. Lisa asks, with universities, colleges, and schools across the country returning for in-person instruction this month, can Dr. LaCroix please share current data on the prevalence of multi-system inflammation syndrome for children and also those over age 18 diagnosed with COVID-19, both confirmed diagnosis and estimated? Also, is there a difference in development if MIS amongst the vaccinated, or I think she means of MIS amongst the vaccinated, boosted, and unvaccinated? So be helpful if you maybe would explain, Doctor, a little bit about multi-system inflammation syndrome, and then perhaps you can answer her question.
That was Lisa?
Yes.
And I just want to congratulate Lisa for asking a really hard question. And the reason it's hard is that this is a syndrome that we don't know a lot about, but MIS stands for multi-system inflammatory syndrome. At first, we were aware of it in children, but now they have a version of this called Miss A for adults, Miss C for children. What this is a condition where different body parts can become inflamed, including the heart, lung, kidneys, brain, skin, eyes, or gastrointestinal organs. So almost any part of your body getting inflamed after a confirmed COVID-19 infection. We know that many children with Miss C had the virus that causes COVID-19 or had been around someone with COVID-19, although it is possible to get this syndrome without knowing that you've had COVID-19, without being sure that that's what caused it. Miss C can be serious, even deadly, but most children diagnosed with this condition have gotten better with medical care. So we don't know the prevalence because this condition gets reported to the CDC, but as prevalence would mean, do we have a sense of right now how many people have had it, how many people have it right now? What we know is that as of January 3rd, 6,431 children had met the case definition and been reported to the CDC, and 55 children had died. That's similar to the number of kids who would have died from chickenpox before we had the chickenpox vaccine. Still tragic, but a small number of deaths. And then I want to say what an insightful question it was to ask about vaccination. The CDC just has published an MMWR, morbidity and mortality weekly report, say that 3 times fast. And they have this beautiful infographic in there talking about Miss C and whether or not the vaccine helps to prevent it. So the estimated effectiveness of 2 doses of the Pfizer vaccine, the only vaccine approved for children to take right now, the effectiveness of 2 doses of Pfizer was 91%. So that's what that 91% decreased risk of getting Miss C. Among critically ill Miss C case patients requiring life support, all were unvaccinated. That's a pretty powerful statement. And so I wanted to show you that infographic. So the occurrence and the lethality of Miss C is greatly, greatly reduced by vaccination. And we were able to study that in 12 to 18-year-olds, but I think it's super important for younger kids to get vaccinated as well. There's also Miss A, the version of this in adults. And you can go to the CDC website and read about the case definition for this. It's like a page of bad things that can happen to your body. I'm going to read you the primary clinical criteria so you can get a sense of this. It's severe cardiac illness, including myocarditis, pericarditis, coronary artery dilatation, aneurysm, a new onset right or left ventricular dysfunction, 2nd or 3rd degree AV block, which is a bad cardiac arrhythmia, ventricular tachycardia, a rash, or a non-purulent conjunctivitis. None of this sounds very fun. And then there's a long list of secondary criteria as well. We have no idea in the adult population how many people have really had that syndrome after COVID. So this is Miss in adults is something we're going to have to learn a lot more about. And I think that's the most honest answer I can give you to that question today.
Sounds like another really good reason to get vaccinated.
Yes.
I'll shift gears again. This is a question from Andy in Solana Beach. Senators Manchin and Sinema seem to think that archaic Senate rules are more important than democracy. Does Rep. Levin support filibuster reform? Why or why not? Well, yes, I do, Andy. And let me first say that it's not just the 2 that you mentioned, it's all of the Republican senators as well. I think we're well served to remember that as we consider all of this. I think that we have to look at the times we're in. You know, last year we saw people in GOP state-led legislatures all across the United States enact some of the harshest voting restrictions since Jim Crow. And they used the big lie, the disinformation being peddled by the defeated former president as justification, the conspiracies related to that. And they introduced literally hundreds of these sorts of voting restriction bills all across the country. I was encouraged to see President Biden focus on voting rights in a more forceful way. Could certainly make the argument that we would have been equally well served had that been done sooner. But nonetheless, hindsight being 2020, I think the key here is that Republicans in the Senate have again made it clear that they have absolutely zero interest in protecting the right to vote, which sadly used to be a bipartisan endeavor. The voting rights extension, most recently, as President Biden has said, was broadly bipartisan. I think it's also important as we consider some of the arguments being made about the filibuster. There's actually a great book that if you haven't read and you're interested in this topic, it's by Adam Gentleson called Kill Switch. Not an ad for his book, but it's a great book. He was a staffer in the Senate for many years. He goes into the history of the filibuster and some of the ways that it was used, frankly, for blocking civil rights legislation for many decades. One of the things that Gentleson makes clear is that the filibuster is not, written, in the Constitution or on stone tablets somewhere. And in fact, just last November, the Senate raised the debt limit and went around the filibuster rules to make sure the government didn't default. I think there are some issues that are so important that they should not get caught in partisan gridlock, and that voting rights is absolutely one of those. So if we can make an exception on the debt ceiling, we ought to be making an exception to protect voting rights. And look, again, the entire Republican caucus, along with the two Democratic senators that you mentioned, they've got to understand that history is not going to look kindly upon them for their refusal to stand up for the right to vote. So could say a lot more, but I will leave it there in the interest of time. Here's another one for you, Dr. LaCroix. This is from Denise in Oceanside. What can you tell us about the vaccines for Omicron? I assume she is referring to the efficacy of the vaccines for Omicron. We've heard a lot about how they're not preventative of infection, but that they're still very protective of severe illness, hospitalization, and death. But would love your thoughts on all of that.
Yeah, I think it's more or less what I can tell you is what you just said. I think a lot of the efficacy, there's data coming out all over the place, most of it not peer reviewed and not yet published, that shows that boosted vaccination with any of the approved vaccines, but especially the mRNA vaccines, greatly reduces the chance of severe COVID from the Omicron variant. The other part of that question is, are we going to get a vaccine that's specifically targeting Omicron? And the answer to that is yes. They're predicting that to be out in March. And then there's things like fourth shot vaccination going on in Israel, but I've yet to see the data showing how much that helps. So I think the consistent message out there, though, no matter what you read in the latest study, is that having a booster within the last 6 months is really important for preventing severe Omicron. I've seen a lot of infected people in my environment the last few weeks, people in our family, students who've been in class, laying down, listening to class with COVID, colleagues, junior faculty, physicians home with COVID, holding their babies, who probably, either got it from their kid getting it at preschool or in daycare, or them getting it in the hospital. They've all been vaccinated and they've all done pretty well. It's not a guarantee. It's not fun to get Omicron. And we know that we've lost colleagues in California from this variant who died way too young. But I think we will have a vaccine targeting this. And I hope in the future that, like when they say we're going to be living with this, I hope that they're speeding up the process of targeting vaccines to whatever variant is circulating this widely. So by the time we get to March, I have the feeling that the Omicron vaccine, yeah, I will get it, but I don't think we're going to have much Omicron running around by then. So we're always going to be chasing the current variant with the vaccine. And if we can close that time up and get those vaccines out fast, it could help a lot. That's all I have to say about that.
Well, here's another one. This is a really specific fact pattern. This is from Mary in Dana Point. She says, can a person be asymptomatic, have a negative PCR test, 24 hours later have a positive PCR result, and 48 hours after test one, so in another day, test negative again? So can you be asymptomatic, test negative, and then positive, and then negative in 3 successive days, all with PCR testing?
Yes, you can, sadly. You know,
But
and it's just,
how
I just,
probable, I guess, is that a probable? Probably not as probable, right?
well, if she asymptomatic throughout, right? The tests have, you know, we once went over how many different tests there were and their various degrees of sort of sensitivity and specificity, their ability to detect if virus is there, their ability to call it negative if there's no virus there. And, you know, the tests aren't perfect. And also when you swab in the nose, and there's been a lot of talk about swabbing in the throat lately, sometimes you don't always get the viral particles on the swab. So there's a lot of ways for these tests to give the wrong answer. And of course, we don't really know if this person had COVID or not. If they were negative throughout, that's weird. They do say that if the PCR is positive, you probably had the virus, but even that it's possible to be wrong about. So I can't explain what happened in that weird circumstance, but there were so many people early in the pandemic that were really sick, that had classic symptoms of COVID, that never tested PCR positive, and they were so frustrated. And so I'm just aware that the testing is not perfect. And with all disclosure, you've been tested a lot, Mike. I've never been tested for COVID.
Oh, wow.
And the reason I've never been tested for COVID, I'll get tested if I go back to campus at a time when they want me to be tested. That hasn't happened so far. When I went back last fall, vaccinated people didn't have to be tested. When I have symptoms, I stay home. And we have a screener that we complete every morning. I'll be tested if it's important for me to be tested, but I don't consider it a panacea for keeping myself safe or anybody else. I think that using our heads about not going out when we're sick and wearing masks when we do go out, social distancing, if there's a lot of virus circulating in the community, is where it's at. And I personally don't think, I mean, I'm going to accept President Biden's tests, and I signed up to get them because there may come a day that I have to be around someone vulnerable and I want to make sure I'm not positive. But I don't think testing's a panacea for anything. So I just did want to share that. Haven't been tested in all these 2 years.
That's amazing. I've been tested plenty,
Yeah.
including any time we want to go and visit President Biden in the White House.
Yeah.
But definitely encourage everybody, go get those tests at the covidtests.gov website. Here's one from Alfredo in Vista. The president has announced that the federal government will be supplying KN95 masks. How will that work? The same is true for at-home COVID tests. What is the status on tests being supplied? Well, I can tell you that the covidtests.gov, I was just listening to an interview this morning with Jeff Science, and he mentioned that for those who have signed up to get their 4 free tests, they just launched the website this past week, and they've already started shipping some of those tests, and they're supposed to get to American households by the end of the month or early next month. Over the next few weeks, they're going to be shipping out 500 million tests to the USPS, and the website was incredibly simple. I just signed up myself to see the process, to understand the process, and it took all of a minute to get the information, and hopefully they'll ship those out soon. Now, those are antigen tests, so they're at-home tests. They're not as accurate. They're still very useful, but they're not as accurate as the PCR tests that go to a lab that require longer to process. Although I must say there is one company called Q Health based here in San Diego that is developed an at-home PCR test, which has been used effectively by the NBA and how they did their bubble at the, for the NBA, and also Google and other companies are doing that. It's just a bit more expensive. But the tests that the Biden administration are sending out are the antigen tests. As far as the masks go, what the president said is they're making 400 million non-surgical N95 masks available free of charge at community health centers and retail pharmacies across the United States. They said on Wednesday that they'd begin shipping those N95 masks to the pharmacies and the health centers at the end of this coming week, and that the masks are expected to be available at the end of the following week, and that the program would be in full gear by early February. And those masks are those that came from the Strategic National Stockpile, which is the nation's emergency reserve, which Congress has helped to improve in the past year through the CARES Act and through the American Rescue Plan. Last question. This is for you, Dr. LaCroix. And this is from Michelle in Solana Beach. She asked, my daughter-in-law got COVID in March 2020 and ended up with long COVID. It has completely changed her life and been debilitating. What is the prevalence of long COVID overall? Is severity of disease an indication of likelihood? And what studies are being done to understand the long-term impacts?
Well, I wanted to say to Michelle that I really appreciate this question. And of all the questions we talked about today, all of which are, timely and important, this one probably has the greatest public health significance for all of us coming out of the pandemic, hopefully, and going into the future. The long COVID or post-COVID conditions is a wide range of new or recurring health problems people may experience, and it's defined as problems that occur 4 weeks after first being infected with COVID. As far as severity influencing who gets long COVID, it's possible for even people who did not have any symptoms or did not know they had a COVID infection to experience long COVID, which can present as different types and combinations of health problems and can range in lengths of time from short to almost indefinitely. We know that some people have had such bad long COVID that they've decided to take their own lives because the pain they were experiencing was too much to bear. So this is something super important for us to study. What kinds of things have been happening to people with long COVID? Well, from the neuropsychiatric perspective, people can have brain fog or cognitive impairment. They can have fatigue, anxiety, depression, post-traumatic stress disorder, and headaches. From the lung perspective, some people have persistent shortness of breath and require ongoing oxygen treatment for many months. In fact, a close friend, epidemiologist in San Diego, had long COVID that she's still recovering from. She was in the hospital over a year ago and is still recovering from COVID, but thankfully doing much better and still here with us. And as far as the cardiac system is concerned, people can have chest pain and shortness of breath. They can also have persistent kidney dysfunction and diabetes, onset or worsening control of diabetes. So these are all, really big chronic problems. And there's a lot of effort, a lot of call for proposals from the NIH, a lot of effort being put towards studying long COVID. You asked, how often does this occur? Sort of what is the prevalence of this? And it's estimated that anywhere from 15% to 80% of people that get COVID might experience long COVID after recovering. That's a pretty wide range of percentages, and that means that we don't really know how common this is. The NIH has started a research initiative called RECOVER, which seeks to understand, prevent, and treat long COVID. And this term called PASC, which stands for post-acute sequelae of SARS-CoV-2. And this is the term scientists are using to study the potential consequences over the long term of COVID-19 infection. So we hope to learn a lot more about this. I think the papers that are out there so far are so, let me just say, leave a lot to be desired. I don't want to disparage the science that's coming out early because it's hard to do. I just want to say that it's a beginning. It's certainly not good enough. We need to do a lot better. And I actually show these papers to my students and say, how can we do better? Here's the latest paper from Italy. Here's the latest paper from Switzerland. How can we do better than this method for studying long COVID? So I think we'll be learning a lot more about this. And I think it's going to be like the whole next decade that's going to take to really understand it.
Well, thank you so much. We'll have to leave it there. I'm so grateful to Dr. LaCroix just for always providing your insight. And I think just looking back on the last 18 months or so as we've done these virtual town halls, you've just been such an incredible voice in our community. And we are very hopeful that that Lancet article was accurate and correct in saying that the era of the COVID-19 pandemic is coming to an end. We'll still be living with it, but we will not be living with it in the manner that we have been over the last 2 years. I want to thank everybody for tuning in. Particularly want to thank my amazing wife, Chrissy, without whom none of this would be possible. My parents who are watching, love you very much. And if my in-laws are watching in Arizona, I love you guys a whole bunch. Hope to see you soon. I want to encourage everybody, if you are able, to visit our website at mikelevin.org, where you can sign up to volunteer or you can donate. And also, I thought I would just close this week with the words of Dr. King. If you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But by all means, keep moving. Have a great week, everybody. Take care.